Today, we'll be discussing Botox therapy for hyperhidrosis or excessive sweating. As always, this is informational only, not medical advice. Enjoy. Hi, everyone. Today, we're going to talk about hyperhidrosis or excessive sweating, but particularly, we're going to talk about one treatment, and that is Botox therapy for hyperhidrosis. We do Botox therapy in our clinic, in our practice, every week, multiple times a week. It is a very effective therapy and is a therapy that is often covered by insurance. So let's dive into it real quick. I thought this was a great review by Dr. Lowe et al. Discussing the treatment of hyperhidrosis with Botox therapy. So let's review most of the charts and graphs because I think they say more than I could ever tell you in words. So here, this first diagram demonstrates hyperhidrosis as it relates to the DLQI, which is the Dermatology Life Quality Index. It's a survey that determines how much a specific condition is impacting one's quality of life. So the DLQI measures many things: your symptoms, your ability to participate in society, sleep, etc., etc. So a higher DLQI is worse, meaning that a condition that leads to an average higher DLQI for a patient population is a disease process that impacts that patient population more. So as you can see, acne and vitiligo, which we've discussed previously, leads to significant impact in quality of life. But even more so than that, you have psoriasis, you have severe acne, you have pruritus, which means severe itch, and then more than all of those, you have hyperhidrosis or excessive sweating. So this hyperhidrosis leads to significant quality of life impact in patients. Moving on, I thought this was a really interesting chart. So the orange line is the Botox therapy, the gray line is the placebo. And on the y-axis, you have proportion of patients changing clothes 2 times per day. So if you're sweating more, you're going to be changing your clothes more often. And as you can see, after the initiation of Botox therapy, that deep decline in the orange line, meaning they are changing their clothes much less often, compared to the gray line, the placebo line, the line that didn't get the treatment, is staying relatively similar, demonstrating that your quality of life can be significantly improved just with this Botox therapy, just in the fact that you're not constantly sweating through your clothes. So here's a wonderful image. This is a starch iodine test. This is an old school test where you put the starch iodine on the axillae, the armpits, and then over time, as you sweat, you can see the degree of spreading and you can see how much sweating is occurring. And then you can see after treatment B, even with the same compound in the axillae, the significant decrease in that spread. Here's another great graph. So you see week 1, 4, and 16. Orange again is Botox therapy. Gray is placebo. The y-axis is proportion of subjects with at least 50% reduction from baseline in axillary sweating. So you can see the significant majority of patients have greater than 50% decrease in sweating, even up to 16 weeks. And this diagram, what it shows is that the mean sweat production of those with Botox therapy declines rapidly with treatment. So you can see the orange line Botox therapy, the gray line placebo, and the significant difference in sweat production. Here you can see just a couple studies comparing 75 units versus 50 units. As you can see, both lead to significant improvement. If we move down here, again, 75 and 50 units, again, very similar improvement. We typically, in our clinics, and what's typically allowed via insurance, is 50 units per axillate or per underarm. And then finally, just the estimates of hyperhidrosis. A 2004 study showed that almost 3% of the population in the US has hyperhidrosis. And another 2016 study showed that up to 5% of people in the US might be battling hyperhidrosis. So up to 5% of the US population, that's almost 20 million people that can be impacted by this condition. And remember, if we scroll up here, there's a significant impact on our quality of life. Now, if we go to my website here, it briefly reviews what we just talked about with some of the same diagrams. We talk about Botox for the underarms, and then importantly, we talk about Botox for the hands and feet. Now, I mention this because sometimes as a dermatologist, we have trouble getting Botox for the hands and feet for my patients because insurance will come back and say it is not, quote, FDA approved for this indication. But in fact, in places like the VA, we do this all the time with significant improvement. Yes, it's a little bit more painful, but the patients keep coming back every 3 to 4 months because it works that well. And here is a summary of studies that show the efficacy and safety of Botox for the hands and feet. So I implore you, if you ever ask for Botox on the hands and feet and your provider says it's not covered, we probably won't get it for you, try anyways. If they deny, appeal and show studies that indicate it works, and you may be able to get it covered for yourself. As always, this is not medical advice, this is just information. If you thought this was helpful, please like it, please share the video to others that you think might benefit. It helps my channel out and it helps me reach others who might benefit from this information. I'll have another video on generalized hyperhidrosis, sweating, the various treatments, topical, oral, and interventional therapies like Botox, like surgery, like microwave ablation, etc., etc. So stay tuned for that, and as always, have a nice day.